Have you noticed a curve, discomfort, or change that makes you wonder if something isn't quite right? Let's talk about what could be happening and why it may not be as alarming as you think. For many men over 50, changes in that area can feel confusing, even alarming. Maybe you've noticed discomfort. Maybe things don't look or feel quite the same as they used to. And for a lot of men, the first reaction is silence. You hope it goes away. You tell yourself it's nothing. You avoid talking about it. But here's the truth. Some changes are normal with age. Others deserve a closer look. One condition that often raises questions is Peyronie's disease. It sounds complicated, but at its core, it involves the development of fibrous scar tissue, often called plaque inside the penis. This plaque forms within the erectile tissue and can affect flexibility. When that flexibility changes, shape can change too, and that's usually the first thing men notice. Some experience a bend or curve that wasn't there before. Others notice narrowing in one area, almost like a pinch in the middle. Some describe an hourglass-like indentation. In certain cases, there may even be a noticeable loss of length. These changes can happen gradually, which makes them easy to dismiss at first. Now here's something important. Not every man who experiences minor trauma develops this condition. In fact, many small injuries heal completely and quietly. But in some cases, the healing process becomes overactive. Instead of restoring smooth tissue, the body lays down thicker scar tissue. That scar tissue doesn't stretch the same way healthy tissue does. This is where other factors come into play. Age-related tissue changes, inflammation, genetic predisposition, connective tissue tendencies. These influences can make healing less predictable as we move into our 50s and 60s. Before we continue, if content like this from Health After 50 makes you feel more prepared and more at ease, we really appreciate you liking this video. Thanks. Now let's talk about symptoms more clearly. During the early stage of this condition, often called the acute phase, the plaque is actively forming. This is when changes may still be evolving. Curvature might increase over several months. Pain can be present, especially during erections. Some men describe tenderness even without an erection. That pain can be unsettling. But here's something reassuring. For many men, that discomfort does not last forever. After a period of time, often 6 to 18 months, the condition may move into what's called the chronic phase. In this stage, the plaque stabilizes. The curvature usually stops worsening. And most importantly, pain often subsides. The shape may remain altered, but the active inflammatory process quiets down. Understanding these two phases is important because it changes how we think about treatment. In the acute phase, doctors may focus on reducing inflammation and preventing progression. In the chronic phase, the focus may shift toward correcting curvature or improving function. Now here's something many men don't realize. This condition does not automatically mean the end of intimacy. That fear is common, but it's often exaggerated in our minds. Mild curvature may not interfere with sexual function at all. Moderate cases can sometimes be managed with medications or non-surgical therapies. Even in more significant cases, there are medical procedures available that can improve function and confidence. The key is not ignoring it. Silence tends to amplify anxiety. Information reduces it. If you've noticed changes, the most important step is having a conversation with your doctor. Yes, it may feel uncomfortable, but physicians who treat men over 50 discuss these concerns every day. You won't shock them, you won't embarrass them, and you may gain clarity that brings significant peace of mind. It's also worth remembering that aging affects all tissues in the body. Skin becomes less elastic, joints stiffen, healing slows. The same biological principles apply here. That doesn't mean something is wrong with you. It means your body has changed, and understanding those changes gives you power. Another thing that helps is perspective. Conditions like this are more common than most men think. But because men rarely talk about them openly, it can feel isolating. You might think you're the only one dealing with it. You're not. And here's an encouraging thought. Many men who seek evaluation discovered that their condition is mild, stable, and manageable. Others learn that there are clear next steps that can help. The worst position to be in is uncertainty combined with silence. Now let's briefly touch on something practical. If you're in the acute phase and noticing pain or progression, early evaluation can make a difference. If you're in the chronic phase and things have stabilized, that stability gives you options. Either way, you're not powerless. What matters most is awareness without panic. Health after 50 is about exactly this: facing changes with information instead of fear. Our bodies evolve. That's part of living longer. But evolving does not mean surrendering control. It means adapting wisely. If you've noticed curvature, narrowing, discomfort, or length changes, consider it a signal to gather information. Not a verdict, not a catastrophe, just a signal. And sometimes, simply understanding what phase a condition is in can dramatically reduce anxiety. When you know that pain often fades in the chronic stage, that knowledge alone can ease worry. When you know curvature typically stabilizes rather than endlessly worsening, that brings perspective. The goal is not perfection. The goal is function, comfort, and confidence. And that is still very possible after 50. We would love for you to subscribe to Health After 50 if this kind of clear, steady guidance helps you feel more confident navigating changes in your body. If you're comfortable, feel free to say hello and where you're watching from. Conversations like this remind all of us that we're not alone. Take care of yourself.